sir. Thank you, Apao, AIOS, and Dr. Ustagi, sir, for giving me this opportunity to present our survey. So, I'll be talking about rapid assessment of avoidable blindness, their results in the tribal regions of Gujarat and Maharashtra. Uh, as you know, as you actually many of might not be knowing that Raab is a very cheap method. It's like resource limited way it happens, and it doesn't involve the less than 50 years of age population. So the time taken for survey is lesser. As I'm not going in details in the magnitude of blindness, because many of the speakers have already covered it. So I'm directly going towards my study area population. We studied in six taluks of Gujarat and one taluk of Maharashtra state. Rationale was ours was a new NGO, and we needed the magnitude of blindness as well as visual impairment and all. At the same time, we wanted to know what is the what are the causes of blindness in that region, to make good plan for future. So our aim was to evaluate the magnitude and cause of blindness and visual impairment. Objectives were the prevalence of blindness and visual impairment among people aged 50 plus in this area, the causes of blindness and visual impairment. This has been covered, so I am skipping it. As far as material and methodology is concerned, this is a Raab standard protocol questionnaire which is validated, and this is it. We have to fill in data in this form, and we should do entry and get the results. So sample size was 4850 in these 7 taluks. Total of 97 clusters were covered, each comprising 50 individuals, 50 plus age group. Prevalence was defined. Prevalence of blindness was defined as 316 better eye with best correction. Survey teams were formed and they were trained. Training was done by the standard trainer for Southeast Asia. Training of the team was conducted for almost 4 days, and the two teams were trained, and their inter-observer variation and all were calculated, and that because the two teams must actually come to the consensus regarding causes and details of entry. So this is a vision testing flowchart where all enumerated people they were examined, and whoever having more than 612 vision, lens was examined, and if less than 612, then pinhole vision, and then assessment of lens, other ocular comorbidities, and if vision is less than 612, which are the barrier why people are not getting their eyes treated. So the results, the study had good response rate 97.6%, and response rate was higher among female 98.3%. There were totally 116 non-responders. Out of that, one was blind due to cataract and others were believed not blind. As far as prevalence of blindness is concerned, we found it to be 2.1%, and severe visual impairment was also 2.1%. When we extrapolated on the entire area, the prevalence was found to be 2.3%, and severe visual impairment found to be 2.3%. The total number of people blind due to all causes in the entire area was 3767, and cataract was responsible for almost 3013 people, that is 80%. Prevalence of blindness was more among female, and prevalence of blindness, severe visual impairment and visual impairment increased gradually as age increased, as is seen in these graphs. Main causes of blindness: Obviously, cataract was the major cause of blindness, followed by all globe or CNS abnormality, corneal scarring, and corneal scarring again at national level. 2015-19 survey also was found to be second most important main cause of blindness. I think it is 7.2% at national level. Cataract surgical complication, phthisis and other posterior segment disease accounted for 3.1%. So also the glaucoma and other diseases. Principal causes in severe visual impairment and MVI categories was also untreated cataract, and that was responsible for 93.3%. As we know, the treatable causes due to blindness were 80%. So we can easily, if we take intervention, we can easily control that kind of part of blindness. So as far as strength and weakness of this Raab survey is concerned, Raab is done in 50 plus population, so less than 50 we don't have data, but extrapolation can help us very well. But strength are like it is cheaper than other like other population based surveys and studies. So we came with the recommendation, clear-cut recommendations, and because ours was the hospital to be started in tribal area where in 100-kilometer radius there was no other eye care facility, so we could come up with the recommendations. We found there is a need to provide effective cataract surgical services in the area as prevalence is very high. Though Gujarat is doing very good in eye care front, but in red zones, which is like bordering areas of Gujarat and Maharashtra, Gujarat and Madhya Pradesh and Rajasthan, the eye care facilities are have not reached, and we need to do more in those particularly red zone areas as government have declared. There is a waiting list in the hospital and distance to travel is much more in certain areas. So our hospital was intended to fill that gap. The people in this tribal area are poor. Coming to the hospital would cost them much in the form of lost wages, as Dr. Kansuk rightly said. There are barriers, we need to overcome that. So transportation facility is very much necessary, as and eye camps are only way. The awareness is also very important to actually remove the barriers. Females were more blind than males, so we need to educate people in that front. Planning and implementation of Vision 20 program has also started in our hospital. There is no coordinated efforts in terms of eye care in the area. So careful planning and networking with the public, NGO and private sectors will be helpful. We are running 3 or 4 vision centers. Out of that, one is PPP under PPP model, one is with private hospital. So we are collaborating at different level. Increasing human workforce, infrastructure development and cost-effective disease control are principle of Vision program, and that's why we have started the training program also for paramedics. There is no research or evidence-based ophthalmology practice in state, so we wanted to fill that gap also. So lastly, the conclusion: the prevalence in this tribal area adjoining Gujarat and Maharashtra state of blindness is higher than the national average. Cataract remains the main cause of blindness. Females were affected more than males due to social priority to males in every sphere of activity in the society. Surgical complications are also noted, as we saw in the national survey also. National survey also says that the third largest cause of blindness is surgical complication. So we need to think about that also. High prevalence of blindness and non-availability of the eye care surgical services in the area together imply that there should be a good outreach program and to and fro free transport facility with mechanism to bring cataract blind people to the surgical facility must be planned, along with cataract surgeries with good quality provided totally free or with high subsidy to the tribal populace at the base hospital. Thank you so much for your patience listening. Thank you.